Okay, thank you. So we continue with understanding how to manage now, especially the chronic depression or the most severe one. How do we go about it with medication and the psychotherapy?
Earlier I said, just a mild depression can be treated just through psychotherapy. But when it comes now to very severe, and it is now under in Kenya, I don't know what we have. In US, we have what we call the DSM-5 now. Diagnostic Statistic Measure is a book that categorizes all the behaviors and give the name to the disorder. When the depression is now considered severe depressive behavior or illness, one, psychotherapy alone cannot be enough, because if your psychotherapy cannot do it, then it means it has now been in a level where the brain chemistry also contributing to this kind of disorder. And this is where we are saying, people, the doctors, this cannot be prescribed by a psychologist. Medication should be prescribed by a psychiatrist.
Okay, what's the difference? The psychiatrist and the psychologist?
I'm dealing with the behavior.
Yes.
And the thinking kind of things. It's basically the behavior. And coming up with the modalities and theories that can be able to manipulate your behavior and start functioning in a different way. If you're irrationally thinking, I can be able to bring you to a level where you can start being rationally thinking. Okay. But a psychiatrist, his training is emphasis on medication, on mental illness medication and treatment. Just like the way you go to a specialist for cancer, a specialist for this, a gynecologist, you come to a psychiatrist that deals with mental health, which he understands how the brain system is working. And that's why we are saying in depression, there is brain chemistry that a psychiatrist can understand, and he's the only one who can be able to prescribe medication. Then it will require both combination of the psychiatrist and the psychotherapy. Psychotherapy, I need to see this patient for about probably by 15 or 20 sessions. A psychiatrist needs to be with you only for 20 or 30 minutes in a month. Just to look at how you are behaving, how your medications are, and a good psychiatrist is the one who will also look the report of the psychologist to see, after I prescribed this medication, what did the psychologist see? So severe depression will require both medical and psychotherapy.
So they have to
because
work
psychotherapy,
hand in hand.
Hand in hand. Psychotherapy will give you more time to deal with the behavior.
Yes.
And the psychiatrist will give you medication to alter your brain chemistry. So that is now severe level. If it goes to that level, many years, and I don't know whether Kenya is still doing this. America is now trying to get away from this, but although in 80s, 90s it was there, it is what we call electroconvulsive therapy, ECT. Electroconvulsive therapy. It is called ECT. This is a medical treatment that most common used with patients with severe major depression or bipolar disorder. And the way we do this, it involves a brief electrical stimulation of the brain.
Oh, doctor.
And I've done this before with the psychiatrist.
Electrical
Introducing stimulation of your brain. And this is the way it's done. It requires anesthesia because that's maulale. It requires anesthesia.
At least I will not be alive.
You will not be alive. And then there are all electrical wires that are connected to you and to your head. And psychiatrist knows exactly how to deal with this. And what they are doing with this electrical shock, in fact, some people call it, even some countries, they call it electrical shock therapy. Wow. Electrical shock therapy, which means a stimulation of your brain. We turn the switch on and it stimulates your brain, it changes.
Like the way tunafanya the vehicle. jamming.
Yes, you jumpstart the vehicle. You jumpstart the vehicle. The battery is down. You bring it. You jumpstart, and then starts.
You know, I'm imagining a vehicle when it's stalled on the road.
Yes.
And then another battery that is already running comes.
I appreciate that analogy. That's a very good analogy. When somebody comes to this level of ECT treatment, this person requires a jump starting because cannot function. Umejaribu medication, psychotherapy, everything has refused to work. This person can only be jump started now to be able to function.
The brain.
Yes. So that's why we call it, because we use the electronics to stimulate the brain. But it requires a good trained psychiatrist, a medical doctor, and an anesthesia to put you to sleep, and a psychologist to see all these things.
So it's not like the patient is going to be in pain, or they're not going to know exactly what is happening.
Yeah, because it is that is the last resort of the treatment. That cannot be the first thing to look into. That should be the last resort of treatment.
When everything else
has failed. And this thing, it is done commonly, it requires about 3 times a week for about 6 to 12 treatments. 3 times a week.
That would call for hospitalization.
When you're in that level, you are hospitalized. You're in that level, you are hospitalized. Wow. You are completely hospitalized when you're that level. So ECT has been used since 1940s. In 1940s, and many years of research, they said that they have worked. But today, some developing countries, they are running away from that approach.
Why? Why would
the new research are coming and saying it has a repercussion that it does not bring a total healing. Eventually, person goes back to the therapy, to the problem.
Yeah, because I'm just imagining, like now the example you've used about a car. If the same car goes and stalls again, it will need yet another jump start.
Because the battery is down.
I'm just imagining, if you have to shock my brain, it means at some point, if it's some wires which were disconnected, now I'm imagining, I don't know.
You're in a car right now. Yeah.
Yes. If there's some things which are disconnected in the brain, they have come together, and then at some point, then again, they're apart.
Yeah.
I mean, isn't the brain going to completely die at some point?
That's why we are saying now today we have got mixed results of the literature. That there are some people who are in support of ECT, electrical therapy, or the electroconvulsive therapy. But there are some developing countries like US today, they will not use that approach. They are running away from that approach. Unless very rare, probably 1%, they will go to that approach of electrical shock therapy. The research have shown that it is not a long-term healing process. It's not a long-term healing process. So there are mixed studies about this. The developing countries, there are some still who are doing it.
Maybe in Kenya we have.
I don't even know in Kenya.
Because we have very qualified psychologists and psychiatrists.
Yeah.
Maybe like places like Mathare, we have the mental health institutions. Maybe there are those. But what when the person wakes up, will they be disoriented or in a situation that is somewhat
the person is disoriented. Remember, this person is already asleep.
Yes.
So this person will have to wake up again and disoriented a little bit.
And you've already done something to the brain.
And we watch the behavior from there, how things will go. As I said, it's a mixed studies. Some studies say that there are good results. Others are saying, because it is just like the cholesterol. For many years, we were told that eggs are not good.
Yeah.
For many years. And so we ran away from more yolk, from all the eggs.
And we were eating them even before.
Correct. And now the new studies are saying eggs have no problem. So I eat eggs as usual. So the same thing with the ECT therapy. There are some studies saying that the treatment works. But today, current studies, after following with the new knowledge, and the challenges people are getting, we find it does not have the long-term effect on the behavior.
Okay.
But that should be the extreme way of treating depression.
So the best way, we start with psychotherapy, then we come to a combination
medication
of psychotherapy and medication. And the worst gets to worst, that is when now you go to the ACT.
Correct. That's the final operation.
Wow.
Yeah.
I think
and we cannot, and remember, we cannot only use the medication and forget it. No. Medication must be monitored, and psychotherapy must work together.
Okay.
One or the other is not enough when it is very severe level of depressive behavior. It requires both.
So let us ask ourselves, if now you are depressed, and especially the severe one, and it's left untreated, what happens? What are the effects of depression?
Because, as I said, mental illness is, depression is a mental illness. If you don't go to the hospital when you have cancer, or when you have flu, or when you have malaria, what happens? There are consequences of lack of attention.
Yes.
And the same case with depression. If depression is untreated and is not addressed, it can cause very severe problems. Number one, it is possible to commit suicide. Having thoughts of death and suicide are symptoms of depression, remember. Those are symptoms of depression.
Yes, the very
thoughts of suicide and death all the time. If depression is left untreated, these thoughts can be worse.
Does it mean if somebody tells me I don't find the need to live?
Correct.
I feel like I can kill myself.
Exactly. You're giving up.
I should already be able to look and say there is a problem.
This person has been depressed, but no action has taken.
But the person may be looking happy and good and clean.
It can, but there are some other symptoms that we talked about that we are following. That we have to be very vigilant to look for other symptoms. Because we can ignore other symptoms. And one can put if someone looks happy and the next time is a different person, then you're moving to another disorder. We call it personality disorder.
Oh.
That's a different disorder altogether.
Wow.
So
we have a lot to learn.
Yeah, you cannot put two faces. When you start putting 2, 3 faces, then it is no longer just one depression.
Yes.
It is now multiple personality disorder.
Okay.
Now here we are dealing with the depression.
Yes.
So if it is untreated, then suicide is possible to occur. If it is untreated, addiction can also happen. How can addiction happen? When the depression symptoms are always there, someone will try to alleviate or to get rid of these symptoms by drinking too much, or by eating too much,
to make them feel
or by
better.
using drugs to make me happy for a short moment.
Yes.
If I'm just sleeping and I don't feel energy or loss of energy, I'll take drugs, I'll take alcohol, I'll feel happy for 1 hour, and then I'll go back. So eventually, as a result of this continuous drinking and use of substances, abuse substances, drugs, you end up developing addiction. So I've said, if we don't treat depression, it will cause suicide, addiction. And addiction is the use of medication or the drugs or alcohol to release the symptoms of depression. But remember, it's a short term, it's just for a short time. Yes. So it can cause a problem. If it's untreated, it is easy to start developing what we call self-injury. That is another way of people trying to cope with depression, is by self-injuring or inflicting pain upon themselves with methods like cutting or burning. Unaona mtu anajikatakata na kisu na wembe, or burning, not feeling pain. This is what we call self-injury. And in other words, we call it self-nutrition. Self-nutrition. So this kind of behavior is an indicative of a depression, but one is not addressing it. There's also what we call reckless behavior. Someone who is depressed, you find this somebody who just want to drive the vehicle very drunk and carelessly, and can easily cause the problem. So these are some of the kind of behavior that we find happening if the person is not treated. And remember, suicide is a very high possibility. So it is important that we address the issue of depression and not look at it and let it go like this.